Healthcare decisions. In the absence of an advance directive, medical personnel rely on family members to determine what a patient's wishes might be. Family members often struggle to make these difficult decisions. However, many of these difficult decisions can be avoided with advanced planning. A living will is an advance directive that allows you to make informed decisions about medical treatments you may want or don't want should you become terminally ill or permanently incapacitated. The time to make a living will is when you're healthy or before you have surgery. It's best to make a living will when you're young, as unforeseen events can happen. You don't want your family fighting or having to guess what you'd want if you become incapacitated. A living will takes effect when one doctor, or sometimes two, depending on your state or what's in your living will, determines that you are either permanently incapacitated or terminally ill, that you cannot communicate in any way, including by gestures, that your condition qualifies as permanent incapacitation or terminal illness under your state's law. For a living will to take effect, the treating physician must certify in writing that you are in such condition. At that point, the living will determines your treatment or care. A living will can include which treatments you want should you become permanently incapacitated or which treatments you don't want. Some of these requests include permitting or not permitting, resuscitation or do not resuscitate DNR orders, feeding tubes and organ donation, use of oxygen by intubation or by other means and dialysis, assisted feeding and hydration, pain medication and other medication, what type of funeral you want, such as burial or cremation, who you want and don't want making decisions for you. Ensure your living will is clear so that it communicates exactly what you want and what you don't want. Clarity will help avoid any confusion. What is the purpose of a healthcare power of attorney? A healthcare power of attorney, POA, is a type of advance directive, but it's broader in scope than a living will. If you give someone, called your agent, a healthcare POA, you're allowing them to make medical decisions when you're unable to do so. These medical decisions are not end-of-life decisions, unlike the situations applicable to living wills. Instead, such decisions involve medical care when you're temporarily incapacitated or temporarily unable to communicate. Why you should have both types of advance directives. To fully protect yourself, it's important to have both a living will and a healthcare POA. Both advance directives are crucial to have a comprehensive medical plan in place. These documents also are essential estate planning tools. Both a living will and a healthcare POA protect you during your lifetime if, for example, you're unable to communicate because you're incapacitated or are under anesthesia, or if you're near the end of your life. Myths about living wills and healthcare POAs. Myth number 1. You must have a living will to stop treatment near the end of life. False. Treatment that is no longer helping can be stopped without a living will. Physicians will generally consult with your healthcare agent or close family when you cannot speak for yourself. The goal is to make the decision you would make if you had the capacity to speak for yourself. However, having an advance directive can make the right decision easier and help avoid family disputes. Myth number 2. You have to use your state's statutory form for your advance directive to be valid. False. Most states do not require a particular form, but they do have witnessing requirements or other special signing formalities that should be followed. Even if your state requires a specific form, doctors have a legal obligation to respect your clearly communicated treatment wishes in any manner or form expressed as long as the wishes are medically appropriate. Myth number 3. Directives are legally binding, so doctors have to follow them. False. Advance directives are legally recognized documents and doctors must respect your known wishes, but doctors can always refuse to comply with your wishes if they have an objection of conscience or consider your wishes medically inappropriate. Then they have an obligation to help transfer you to another healthcare provider who will comply. Myth number 4. An advance directive means do not treat. False. No one should ever presume it simply means do not treat. An advance directive can express both what you want and what you don't want. Even if you do not want further curative treatment, you should always be given palliative care, which is care and treatment to keep you pain-free and comfortable by addressing your medical, emotional, social, and spiritual needs. Myth number 5. If I name a healthcare POA, I give up the right to make my own decisions. False. Naming a healthcare agent POA does not take away any of your authority. You always have the right, while you are still competent, to override the decision of your proxy or revoke the directive. If you do not name a proxy or agent, the likelihood of needing a court-appointed guardian grows greater, especially if there is disagreement regarding your treatment among your family or between family and doctors. Myth number 6. Should I wait until I am sure about what I want before signing an advance directive? False. Most of us have some uncertainty or ambivalence about what we would want, and our goals of care change over time. A young adult may not be ready to contemplate end of life, but that individual can think about an appointed health care agent in case of serious accident or illness. Myth number 7. Just talking to my doctor and family about what I want is not legally effective. False. Meaningful decision with your doctor and family is actually the most important step. The question of what is legally effective is misleading because even a legally effective document does not automatically carry out your wishes. Myth number 8. Once I give my doctor a signed copy of my directive, my task is done. False. You have just started. First, make sure your doctor understands and supports your wishes and you understand your state of health, likely futures, and options. Second, there is no guarantee that your directive will follow you in your medical record, especially if you are transferred from one facility to another. You or your proxy should always double check to be sure your providers are aware of your directive and have a copy. Myth number 9. If I am living at home and my advance directive says I don't want to be resuscitated, EMS will not resuscitate me if I go into cardiac arrest. Usually false. Your advance directive will usually not help in this situation. If someone dials 911, EMS must attempt to resuscitate you and transport you to a hospital unless you have an out-of-hospital do not resuscitate order. A majority of states now incorporated instructions about whether or not to attempt resuscitation in a special set of portable medical instructions. Myth number 10. Advance directives are only for old people. False. It is true that more older rather than younger people use advanced directives, but every adult needs one. Younger adults actually have more at stake because if stricken by serious disease or accident, medical technology may keep them alive in a vegetative state for decades. Young adults should at least appoint a proxy decision maker.